Hello, and thank you for watching. In this presentation, we will be discussing the importance of using evidence-based practice in the field. In order to be able to do that, we must first understand how to be good consumers of evidence-based research. We become great consumers of research by using the best available research to inform our decisions. We will highlight how to gauge what is good research and what may need further investigation later on in this presentation. I have developed a 10-step guide to explain the best practices in evidence-based practice. Before we get started on the list, let's talk about what evidence-based practice is. The BMJ Journal defines evidence-based practice as the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. The practice of evidence-based medicine means integrating individual clinical expertise with the best available external clinical evidence from the systematic research. So, evidence-based practice is using your clinical expertise in conjunction with external evidence. The third factor, which is mentioned in the article, is the patient's needs, values, and wants. We must take all three of these things into consideration to make the most informed decision in selecting a treatment plan. This should be ingrained in our practice since it falls within our Code of Ethics set by the American Therapeutic Recreation Association, or ATRA. One of the principles in our professional Code of Ethics is competence, which states recreational therapy personnel have the responsibility to maintain and improve their knowledge related to the profession and demonstrate current, competent practice to persons served. In addition, personnel have an obligation to maintain their credential. The most efficient way to achieve this is through reading evidence-based research. Now that we have defined evidence-based practice, let's get started on our list. Number 1. Develop the right research question. The first step in finding great research is coming up with a great research question. As the Writing Center's website for Empire State College states, if you know a lot about the topic, you can develop a research question based on your own knowledge. But your question should not be too narrow or too broad. For example, what is the success rate of cognitive behavioral therapy on adolescents with anxiety disorders is too narrow because it can be answered with a single statistic and does not implore any further detail. What can we do to treat anxiety disorders is too broad. This search will yield thousands of results which will likely not be relevant to your client because it doesn't hone in on a specific treatment or population. We cannot use one-size-fits-all treatments with our clients. A good research question might be, does cognitive behavioral therapy reduce symptoms of anxiety disorders in adolescents? This question is focused enough to provide meaningful and relevant articles, but broad enough to yield enough results to make an educated decision on whether cognitive behavioral therapy is an effective treatment method for adolescents with anxiety disorders. Number 2. Use systematic reviews and meta-analyses rather than other types of research. Systematic reviews and meta-analyses are exploratory studies, which often mean there is no predetermined direction for the results. They are less likely to be biased because they are reviewing many research articles that have been written about the treatment or intervention rather than trying to prove a hypothesis. A systematic review is defined as a review of the evidence on a clearly formulated question that uses systematic and explicit methods to identify, select, and critically appraise relevant primary research, and to extract and analyze data from the studies that are included in the review. A meta-analysis is the statistical combination of at least two studies to produce a single estimate of the effect of the healthcare intervention under consideration. It is important to note that a meta-analysis should not be treated as a type of review because the statistical combination of the results from the studies may not always line up with the result of a systematic review of the literature. There are many advantages to systematic reviews that make them essential for evidence-based practice. They are comprehensive reviews that identify, synthesize, and appraise all available research that is relevant on a particular subject and use explicit processes which makes them open to scrutiny to external parties. This reduces the risk of bias and makes systematic reviews replicable. Another advantage of systematic reviews is that they resolve controversy between conflicting findings. This makes them reliable sources to guide decision-making in the field. Number 3. When selecting a systematic review, use the PICOS framework. P stands for population or problem. Does the systematic review examine the population you are interested in? Let's use our earlier example to talk about this model. If I am interested in treating adolescents with anxiety disorders, the systematic review I choose should focus on adolescents with anxiety disorders. You can look at the inclusion and exclusion criteria in the systematic review to determine if it is as broad or specific as you would like. For example, the authors may have chosen studies that included all participants that had anxiety disorders, or they could have chosen articles that excluded participants who had comorbid diagnoses such as depression. This could be an important distinction or not depending on your question and purpose. I stands for intervention. This looks at whether the intervention used in the systematic review is the intervention you're trying to learn about. In our example, we would be looking to see if cognitive behavioral therapy was used as the intervention. A systematic review should be able to identify the type of intervention used and its intensity, frequency, and duration. These are critical pieces of information when planning treatment plans and writing our goals and objectives. If the research shows a particular treatment takes at least 1 month to prove effective, and the length of stay for your clients is between 3 and 5 days, it is obviously not a good intervention to choose for your clients. C stands for comparison. This poses the question, what is the main alternative to compare with the intervention? This is normally referring to the control group, and it should be stated if there was no intervention, if placebos were used, or if another intervention was used for comparison. This is an important factor, so you know if and how you can generalize the results. O stands for outcome. The outcome needs to be well-defined and related to the research question. In the case of our research question regarding the effects of cognitive behavioral therapy in adolescents with anxiety disorders, we would want to make sure the outcome addresses that and not something else. S stands for study design. This is an optional step in the model, but it should be considered to make sure the design of the study makes sense for what is being examined. Number 4. Be critical of the methods used to conduct a systematic review. When reading research, it's important to make sure it's high-quality research. Otherwise, it is not much different than reading advice online from an unknown author whose credentials and motives you do not know. A useful tool for gauging the quality of a systematic review is the PRISMA checklist, which stands for Preferred Reporting Items for Systematic Reviews and Meta-Analyses. This checklist shows that a high-quality systematic review should have their methods clearly stated. This helps us, the consumers of research, to clearly see how the data was gathered for the review, and it makes it so the review can be replicated by other researchers. There are several things to look for in this section, such as eligibility criteria, information sources, the search strategy, the process for selecting the studies, the data collection process, and the list of all variables for which data was sought, as well as any assumptions or implications that were made. The methods of handling data and combining the results of the studies should be stated. And finally, the methods used to assess the risk of bias in both individual studies and bias across studies, which may have affected the cumulative evidence. These are things to keep in mind when applying the research to your practice, because you want to make sure the information you are receiving is reliable and unbiased. Number 5. Make sure the results section of the systematic review reports findings in a thorough manner. As the PRISMA checklist states, the results section should give numbers of the studies screened, assessed for eligibility, and included in the review, with reasons for exclusions at each stage, ideally with a flow diagram like the one displayed here. It should also present benefits and harms of each individual study, along with a simple summary data for each intervention group, effect estimates, and confidence intervals. A forest plot is the ideal way to display the effect estimates and confidence intervals. This section should also report on the results of the assessments that were mentioned in the methods section of the risk of bias across studies and in each individual study. As recreational therapists, It is imperative that we take into consideration all aspects and implications of the treatment or intervention we are researching, so we can make informed decisions that benefit our clients and further their progress. Number 6. Critically appraise the discussion and conclusion sections of the systematic review. As a practitioner, this section of the systematic review has the most meaningful implications on our daily practice. The summary of evidence is presented here, showing the strength of evidence for each outcome and their relevance to key groups such as policymakers or healthcare providers like ourselves. A high-quality systematic review should state its limitations at the study, outcome, and review levels as stated by the PRISMA checklist. Essentially, we want to see, was this intervention successful, to what extent, and how reliably? According to the Code of Ethics from ATRA, this is our number one responsibility as professionals in this field. The first principle in our Code of Ethics is beneficence, which states recreational therapy personnel shall treat persons served in an ethical manner by actively making efforts to provide for their well-being by maximizing possible benefits and relieving, lessening, or minimizing possible harm. Research-based practice is the only way to adhere to this principle. Number 7. Be mindful of who funded the research. In the PRISMA checklist, the assessments and reporting of the risk of bias is mentioned several times, because it's that important that research be unbiased and objective, rather than trying to further an agenda. A systematic review should describe the sources of funding and the role of funders for the review, and you as a responsible consumer of research should consider the implications of this before deciding to apply the evidence in the review. If all of the things we have already talked about have been detailed, such as the reasons for exclusion of studies at each stage, this should not be a huge factor. However, if you are reading a systematic review about articles that examine the effects of using photography as a therapeutic intervention on adolescents with anxiety, and you see that it is funded by a company that specializes in selling cameras, you may want to take a second look at the methodology, how the risk of bias was assessed, and the inclusion and exclusion criteria for the studies. It is our responsibility to use unbiased research as the basis of our evidence-based practice, and we must make an active effort to be aware of it. Number 8. Use evidence-based research to advocate for yourself and your clients in the field. As recreational therapists, we can be met with resistance depending on the institution or setting in which we work due to a lack of knowledge about our field. Oftentimes, we will need to advocate for ourselves to serve clients with the best practices. As Stumbo and Wardlaw stated, evidence-based practice can give us confidence that our interventions are based on a solid foundation. Having the research will lead to increased programming efficacy and the ability to better communicate with the rest of the treatment team by showing them how the interventions you have chosen work within the comprehensive treatment plan. Number 9. Educate others about recreational therapy through evidence-based research. This step is somewhat along the same lines as the last step, but it is significant enough to merit further detail. As Adams Cooley states, therapeutic recreation is identified with controversy as its advocates and practitioners struggle to further define and establish its deserved esteem among other health professions. As practitioners in the field, we will have to strive to maintain the progress already made and continually endeavor to improve the status of therapeutic recreation. Evidence-based research helps minimize unintended variations in services and regulates the field, making our services reliable and consistent. It also helps us to choose interventions with predictable client results, increases communication between therapeutic recreation specialists as well as other disciplines, provides clients and colleagues with reasonable guarantee that programs and treatments have a specific purpose, and proves that services are up-to-date, accountable, and based on both best practice and evidence. You can't argue with results. Number 10. Remember that evidence-based practice is the standard and apply it every day. As stated in the article titled Evidence-Based Practice, What It Is and What It Isn't, many clinicians get in the habit of doing what they have always done, which may no longer be an effective way to treat their patients. It is easy to fall into the idea of the tried and true interventions and treatments, but understanding the reason behind the need for evidence-based practice should encourage practitioners to stay up to date and knowledgeable about current research being done in the field. We can't treat our patients with outdated interventions if there have been new methods discovered that are more effective. And we definitely do not want to keep using the outdated treatments if they have been shown to actually cause harm to patients. Evidence-based research gives us the ability to decide which interventions will be the most effective for our clients. This process can be improved by searching for related research and theories and by applying them to develop best practice. In other words, the interventions that we provide are most likely of all possible options to produce the desired outcomes in the most systematic, efficient, and effective manner. Aside from being unprofessional, it is unethical to not use evidence-based practice, and it could result in losing licensure since it is a violation of our code of ethics as defined by ATRA. As a recreational therapist, you may have heard the saying, we need to provide the right client with the right intervention at the right time for the right duration. That is the standard and level of competency evidence-based practice will help us attain so we can give our clients the best care.